Welcome to the Commonwealth Matters. I'm your host, Richard Nelson. Gender transition of minors has been adopted as normal, even a right for children to pursue. Parental rights have taken a back seat to their child's perceived gender identity, and many institutions are increasingly siding with the child over their parents. California has recently become a sanctuary state for minors who are suffering from gender dysphoria. So what are we to make of this? And what's a parent to do in a culture hostile to their rights and to the truth? To talk further about this is Dr. Miriam Grossman. Dr. Grossman is a board-certified child, adolescent, and adult psychiatrist. She's a medical doctor, and she's also the author of 5 books. Her latest is called Lost in Transnation, a child psychiatrist guide out of the madness. And Dr. Grossman also appeared on Matt Walsh's documentary, What is a Woman? Dr. Grossman, welcome to the program.
Thank you, Richard. Great to be here.
Hey, before we began, I mentioned to you that I'm going through your book, and I thought I'd have it finished by now. I'm about 2/3 of the way through, and I'm going to be very frank and blunt, and I'm alarmed at several of the things that I'm reading here. I consider myself somebody who's well-versed in issues of gender ideology and what's going on with the gender identity movement. And you share some things in your book that are enlightening, but downright disturbing as to what's happened in the medical community, what's happened as far as public policy, and where the cultural tide is moving regarding gender identity, specifically with children. There's a lot that we could talk about, but really I want to key in on what's going on in the medical profession. Many of our listeners and viewers know that the Commonwealth Policy Center took a lead in Senate Bill 150 last year. That's a bill in the state legislature that pushed against gender ideology in public schools. It also protected minors with gender dysphoria from pursuing hormone therapy, puberty blockers, or gender transition surgeries. So Kentucky's in a good place as far as protecting children. But Dr. Grossman, one of the most challenging things we faced in the committee meetings and getting this through the legislature was this. People said, well, all of the medical professional organizations endorse this. How can you go against what they're saying? So I'd like to start with that. Let's drill down, if we could, into how did the medical establishment somehow endorse this idea and get on board with this idea that children should determine their own gender, and we should just go along with that?
I just want to start by thanking you for having me, for congratulating you on the fine work that you've done in Kentucky. I'm so pleased to hear that the children there are protected against gender ideology, protected against telling them that they might be born in the wrong body, that they may need to, quote unquote, align their bodies with their minds, by using drugs and surgeries. So I'm very pleased to hear that, of the part that you played in that for the kids in Kentucky. I wish that was the case for the entire country. I've been writing and speaking about this issue for many, many years, Richard. I first became aware that kids were being indoctrinated with these dangerous ideas all the way back in 2008. And I wrote a book at that time about sex education called You're Teaching My Child What? And one of the chapters there was on gender. So you have asked how these ideas have infiltrated our medical organizations, the American Academy of Pediatrics, the Endocrine Society, those are the doctors, of course, that prescribe hormones, the American Psychiatric Association. And the way that has happened over the years is that groups of activists with a clear agenda about changing our culture, changing society, and also with an agenda to help, and have compassion for those extremely, extremely rare individuals. I'm talking 1 in tens of thousands of people. It used to be individuals that for some reason felt an intense discomfort with their sex. Now, what happened is that these activists who are doctors within the medical organizations, they were on and are on the committees that are charged with the responsibility of looking at this issue and studying it and coming up with suggestions for policy. So, this is how things happen within these organizations. You can't have every doctor doing their own research on a given subject. You're going to depend on the professional organization to do the research, to do the, whatever debate needs to happen, whatever discussion needs to happen on an issue, and then come up with some sort of guidance for the individual doctors. I mean, when you take your child to the pediatrician or to a therapist, that pediatrician and therapist, they're very busy people. They're going to depend in general, they're going to trust what their professional organization tells them to do. So in my case, that would be the American Psychiatric Association, the American Academy of Child and Adolescent Psychiatry. If you're a pediatrician, it's going to be the American Academy of Pediatrics, and so on and so forth. Now, what's happened is that those professional organizations, and they are eminent organizations, they were always, respected worldwide. And we turn to those organizations for information and guidance. But those organizations, at least in this area of gender medicine, have been captured, have been taken over by activists. And they join these small committees or work groups of maybe 8 or 10 or 12 clinicians, and they look at the subject and they come up with their guidelines. And then the way it works is that those guidelines have to be, approved by the board of the directors of the professional organization. And what's happened is that these committees are made up of a majority of radicalized activists who have a certain endpoint in mind. And they do not consider all the up-to-date research and data that exists on this issue. They basically push through what they want. And so the American Academy of Pediatrics in 2018 published their policy. It was on this issue of the treatment of transgender identifying kids, or what they call gender diverse kids, which actually, your audience should understand that what that really means is just, it's about personality. It's not about sex and being male or female. It's about personality. There are boys that have more feminine interests and maybe more feminine kind of presentation or behavior. And there's girls that have more stereotypically masculine stereotypes that, by the way, we have been fighting for decades to get away from. And now we're forced back to those stereotypes. But what I'm saying is that those committees have an agenda, and the American Academy of Pediatrics in 2018 came out with a policy statement which hook, line, and sinker agreed with this prevailing ideological view that says kids know best who they are in terms of whether they're boys or girls. It doesn't matter how old they are. It doesn't matter what comorbid, coexisting psychiatric illnesses they may have. They may be on the autism spectrum or suffering from depression, anxiety, trauma, schizophrenia. It doesn't matter. The child is in the driver's seat. The clinician must rubber stamp the child's diagnosis. This is the foundation, this is the premise of what's called gender affirming care. This gender affirming care, which is an Orwellian term, because it requires us to affirm a child's belief that is not based in reality.
Very good. Dr. Grossman, going back to the AAP, the American Academy of Pediatrics, which is probably the most influential professional medical organization that would speak to child well-being and best practices for children. You mentioned that they affirmed or adopted gender affirmation of minors, gender affirmation care in 2018, but they did it without any evidence, nor did they do this without any of the rank and file members voting on it. Has this ever happened before? This was a major policy shift that the American Academy of Pediatrics pursued. Has this ever happened before where they adopted something without evidence? It was controversial at the time, but it was just pushed through, as you mentioned, by committees, by activists who served on these committees. They set the agenda. They presented this to the body, but there was no evidence for it.
They presented it. Well, they presented it to the board of directors. They did not present it to the body. They did not present it to the rank and file, pediatrician. They did not allow for debate. They squashed the debate, and they're still squashing it.
Now, this misrepresents really, there are a lot of people, a lot of pediatricians who are clearly opposed to this. I mean, doesn't this kind of political maneuver, which it was a political maneuver, it was not based on science or best practices. Doesn't this split an organization like this, a once very respectable, trustworthy organization? What's happening because of this move? Are you aware of any of the fallout associated with this?
Well, for one thing, there were a group of pediatricians that actually 20 years ago, because the American Academy of Pediatrics was so politicized, even back then on issues such as abortion, contraception for teenagers without the parental knowledge, that a group of pediatricians, including an ex-president of the American Academy of Pediatrics, I discuss this in my book, they split off and they formed the American College of Pediatricians. And so that's a group that your audience need to know about. And their website is acpeds.org. So there has already been a split in that organization. And I believe that there would be more of a split if more pediatricians were aware of, of basically what I write about in my book, which is that gender affirming care is based on one small and very problematic study that came out of Holland on children, a small study of 55 kids. I can't go into all the details. If you've read most of my book, you've probably already read about this. It's called the Dutch Protocol. And this one study that was done, I will explain this. It was a study that included only kids who had severe gender dysphoria, severe discomfort with their sex from an early age, and they also could not have any significant mental health issues. So the people in Holland, the researchers that undertook this study, were very, very careful about who to include, those 55 kids. And only if they met those criteria did they go on to get puberty blockers, which was the first time puberty blockers were ever used in physically healthy kids. I want to underscore these kids are physically healthy in every way. And those kids were given blockers. And then a few years later, they were given cross-sex hormones, estrogen and testosterone. And then a few years after that, if they desired, they were also given surgeries. Now, right. So the thing is that the results, they followed those kids for just a year and a half, not a long time. You really need to follow subjects in a study like this, in which the kids are ending up, many of them, being sterilized. You need to follow them for a good long time. You need to follow up and see what their lives are like, how they feel about their new, their new persona, their new bodies, whether they're pleased, whether they're comfortable, what's going on in their personal lives with their relationships. And we really didn't have that data for decades. Nonetheless, the Dutch protocol was adopted throughout the world by medicine. And now we're looking back at that decision and realizing perhaps it was not the smartest thing to have done, because this was a population, you see, Richard, the population today of the tsunami, the skyrocketing of 5,000% increase in kids that are presenting with this complaint of loathing their sex and wanting to be the other sex. These are not the same population as the kids that were studied in the Dutch protocol. And I explain this in detail in the book. These are kids that developed gender dysphoria as teenagers, not as little kids. They developed it as a result of social contagion. They heard about it at school, from their guidance counselors, from their friends, online, on YouTube. And they were told, they were led to believe that changing their bodies and identifying as the opposite sex would be a solution to their many mental health problems. Because these kids, unlike the kids in the Dutch protocol, I hope that everyone's following me, unlike those kids, have a ton of mental health problems.
Kentucky is at a crossroads. We can choose to give in to the radical left, or we can choose to engage the culture in a God-honoring way.
I started the Commonwealth Policy Center because I believe that Christians have a responsibility to influence government and society to the glory of God. While the Commonwealth Policy Center's made a significant impact, our work isn't finished. If you'd like to join our movement working for timeless values, then head to our website.
To learn more, go to CommonwealthPolicyCenter.org.
If you are just tuning in, I'm Richard Nelson here with Dr. Miriam Grossman, and you're listening to the Commonwealth Matters. We're talking about radical gender ideology and gender transition of minors. Dr. Grossman, many European nations are moving away from so-called gender-affirming care. And it's because what they are discovering, puberty blockers and hormone therapy, is causing to the very young bodies of these children. You had mentioned a case, and I believe it was Sweden, a young girl who was given puberty blockers at the age of 11. And by the age 15, she had severe osteoporosis. She had breakdown in her vertebra. She was, her body was wrecked, for lack of a better term. And that created a public outcry. And that's one example. There have been other examples where these high-dose hormones have damaged young people's bodies. And so we see European nations responding. Great Britain, France, Sweden, Finland, Norway, they are halting. They're aggressive. At one time, it was an aggressive pursuit of gender-affirming care. And it's based on studies. It's based on the medical evidence. They're looking at what these drugs have done to kids. My question to you is, are we close behind? Are we going to see the brakes put on so-called gender affirmation and gender affirming care here in this nation?
I certainly hope so. And I believe we're certainly moving in that direction. And I can tell that you have read the book carefully. That case in Sweden of a girl, she went by the name of Leo. Her skeleton was damaged from being on puberty blockers. Her parents were not told of this possibility. And it was because of this case of Leo and what happened to Leo that the medical authorities in Sweden undertook an investigation of the gender affirming care. And, the hospital actually issued an apology. The hospital where this happened in Stockholm admitted that they had done wrong and issued an apology to that family and other families that were also affected. And the medical authorities in Sweden looked at the evidence, which of course is worldwide evidence. The evidence from Sweden is no different from the evidence that we have here. That's a good thing about medicine, that, there's no difference between, treating the kids in Kentucky and treating the kids in California and New York. The medicine is the same. The effects of these medical interventions are the same. And so it's because of what happened in Sweden with Leo, with that girl and others, that they pivoted away from gender affirming care. And now they will only permit a very, very select, carefully chosen few kids who will be in clinical trials. So they're going to choose these kids very carefully, and they will be watched very carefully as part of a research project. Now, compare that with what's going on here, where in some states, minors can walk into Planned Parenthood and get these medications in 30 minutes.
That's sad. I think of testimony last year in the Kentucky General Assembly, a young woman by the name of Luca Hines. She's come out publicly as a detransitioner. She shared her story of being put on puberty blockers and hormone therapy as just a teenage girl. She ended up having a double mastectomy by the age of 16. And when she testified last year, she was 21. And she explained the severe negative effects that these high levels of hormone have had on her body. She is in constant pain. She has joint issues. She cannot go on long walks or hikes with her friends. She has some other issues as well. But it was interesting that the other side didn't want to hear what she had to say. In fact, they were trying to they interrupt her. They were angry at her. It was a very, very tense atmosphere. There were activists that were filled in the committee room. And I have a hard time getting my mind around this. If you're trying to come to the truth of an issue, you certainly want to hear testimony from all who are involved. And yet that wasn't the case. It was a level of hostility, Dr. Grossman, that I've never seen in a state legislative committee. And I think this is what causes people who have something to say to stay back. They don't want to get involved with that. They're afraid of being targeted. Are you seeing the same as you engage this issue, a hostility, an intimidation factor? What are you seeing regarding this?
Oh, certainly there's hostility, and certainly there's an attempt to intimidate. I'm not going to be intimidated, but you're right. The point that you make about Luca and about how her testimony was met with hostility goes to show, and I'm going to quote one of my favorite talk show hosts, Dennis Prager, truth is not a left-wing value. Okay, and what's even more disturbing to me is that the organizations that are promoting gender affirming care, the same care that harmed so many people, including Luca, they should be inviting people like Luca, the detransitioners, into their meetings. They should, if they were interested in the truth and they were interested in the possible harm that they were doing to their patients, they would be inviting these young people into their meetings and asking them questions about their experience. Where did we go wrong? What should we be doing differently? But forget that. They're never going to be, not only are they not invited, but they are, they are delegitimized.
Very good. Dr. Grossman, I want to refer to something in your book, Lost in Translation. In the very beginning, you dedicate this book to literally hundreds of people, parents, minors, others who have suffered from this gender identity craze that we're in. And as I was reading through, looking at some of the people that you dedicated this to, it really struck me that this is not a theoretical issue. This is not something that's being debated in academia or that somebody wrote a paper on. This gender ideology has affected real people. This gender transition of minors has hurt real people. This idea that children should determine their own gender and parents don't have any say, it's affected real people, hasn't it? Is that what's moved you to write this book?
Yeah, Richard, my practice is dedicated to these families, and I dedicated the book to the parents of these kids because the trauma that they have experienced and continue to experience because of this political social crusade that has successfully captured my profession and so many other parts of our society. It destroys individuals, it destroys marriages, it destroys families. There's a ripple effect. Okay, it's not just, of course, we have to be concerned about the child. Obviously, we're focused on the child, but we need to also be thinking about the effect on parents, grandparents, siblings, the entire community. This has an effect on all of us. Yeah. So yeah, I did dedicate my book to, there's 500 parents from 17 different countries who answered. Yeah, I put out a call to the community of parents and grandparents who are dealing with this issue in their lives. And as you could see over there, most of them do not give their real names. They give some sort of made up name, praying in North Dakota, or, loving my lost daughter in Minnesota, or, those kind of names that they give themselves because they feel intimidated and they don't want to be out in the open. But yes, you are so correct. This is not some theoretical, discussion about this is a concrete, real issue that is destroying lives.
Dr. Grossman, I want to talk about the academic pioneer in gender identity theory. His name is John Money. He experimented on two twin boys, one who was, he lost his penis during a circumcision gone wrong. And Dr. Money got a hold of this one young boy and transitioned him to a girl. And without going into all the details, it did not turn out. But I want to go into who John Money was just very briefly. You document that he was emotionally disturbed. He was a deviant child abuser who publicly supported pedophilia and incest. His testing on the young boy was unethical, immoral, misleading, if you will. To take a human being and treat them like a guinea pig is utterly wrong. Here's my question. This is what I want to get to is, why would somebody like that be still held as credible. He's the academic pioneer, as you mentioned in your book, academic pioneer of gender identity theory. And yet the guy was deeply disturbed. Why is he considered a credible source of gender ideology today?
Well, John Money was a wicked guy. That's just the way that I would like to describe him, as wicked. But the reason why he is so important, you see, is because he introduced this idea of gender. That he introduced the idea that we have not only a physical sex that's based on chromosomes and other things. We have also a psychological sex in our minds of how we feel, which he called gender. And he proposed that gender is completely separate from a person's physical reality. So that was a new idea at the time in the 50s when he introduced it. And it was a revolutionary idea. And, you know, he had his own reasons, as I go through in the book, of wanting to believe that, because he had his own self-loathing of his manhood related to how he was raised. But he was a highly respected academic at Johns Hopkins University. And the story about the twins should be known to everybody. And what he did with the twins, of course, was wicked. But the reason why he was able to succeed and what he did is he told the parents to raise this boy as a girl. And then he reported in the literature, and he reported to the world that the experiment was a success. So what he did is that he used this poor family's tragic experience. He exploited them, and he then reported that this boy who was being raised as a girl was a total success, and therefore his theory about gender is correct. His theory being that there's this separate part there's a sex in the mind, separate from the body, and that we are born, John Money said, gender neutral, that all of us have the potential of eventually identifying as male or female, depending on what culture tells us. And so he used this poor family and exploited them in order to show his theory was true. Now, unfortunately, it took many decades for the truth to come out. John Money was reporting his experiment with the twins a success in the 70s. And it wasn't until the late 90s, well, really, yeah, the very late 90s, that this individual, the twin by the name of David at that time, came out and said, "Are you kidding me? The experiment was a success. The experiment was a disaster. I was a miserable child. I never felt like a girl. I always felt something was wrong with me. I preferred my twin brother's toys. I ripped off the dresses that my mother would put on me. I was not accepted socially by my peers as a girl. His peers used to call him cave woman. He was a miserable, suicidal child. And only when he was told the truth at the age of 14 about his history, that he actually was a boy, did he begin to recover from this trauma. Now, sadly, he had been through so much trauma, and John Money had sexually abused him in his office. David and his brother. Eventually, David committed suicide, and his twin brother died of an overdose. So this is the story of John Money. It's a horrific story, but what I want people to take away from that story is that an arrogant, wicked professional, psychologist with a lot of diplomas on his wall, was able to hoodwink his profession, was able to get the rest of his profession, not everyone, there was pushback, but basically he succeeded in getting his gender theory to become doctrine, so that it was taught throughout psychology and psychiatry and the social work and anthropology, that we are born gender neutral and there's such a thing as gender.
Dr. Grossman, would it be correct to say that gender ideology based on John Money's premise and his idea that you can separate gender from biological sex, that has prevailed in our universities? And I want to share an example of what happened at Brown University. Dr. Lisa Littman did a survey of 256 parents of gender dysphoric children. Very thorough questionnaire. She put the information together, released it, and the gender activists across the country went after her. They tried to cancel her. They ridiculed her. They did all they could to besmirch her name and to discredit her research. Brown University even turned on her for putting this out. They pulled it for a while, and then they distanced themselves from her. And I use this as an example of, we're supposed to, universities are a place where we're free inquiry, and we do the research and we let the facts speak for themselves. And yet here's a case where at Brown University, they didn't find anything wrong with her methods, as I understand it, or with what she found. She just happened to have information that contradicted this radical gender ideology. I'm sure there's other examples of this at the universities, but it seems to me that the university in general has been a hostile climate to anything that would contradict this radical gender ideology movement. Is that accurate?
Of course. It's a tyranny. It's a tyranny that, you simply can't challenge them. They don't allow it. So I think that's called tyranny. But what I want your audience to understand, especially the parents, it's not just the universities, it's the medical centers, it's the professional organizations, it's the American Psychiatric Association. We already discussed the American Academy of Pediatrics. So parents have to be very careful, very cautious. The stakes are very, very high, and they need to be informed. Now, this is, that's the primary reason why I wrote the book. And I want to mention that the book is also, it's lost in translation. It's available in audio so that people don't have to sit down and read a 300-page book. Not everyone wants to do that, but you can listen to it. And I did the narration of that book. Now, I want to mention that for people who are going to buy it, the best way, because Amazon has a lot of scams on their website. There are people that have put up books that are intentionally trying to get you to buy their scam book. It's not my book. It is, it's a scam. So in order to get to the real book, the best thing is to go to miriamgrossmanmd.com. And it's right there on the landing page. You can click on, the book and get to the proper place on Amazon to buy it.
Very good. Dr. Grossman, I know we're running out of time here. What do you recommend for parents of gender distressed children? You do share stories of parents who want what's best for their children, who are trying to get them help, and yet these children go to their public school, and these public schools are secretly, at least there's one example, maybe more in here, of children being secretly transitioned or socially transitioned, if you will, by their schools. What recommendations do you have in that specific circumstance? There's a family, parents who are trying to steer their kids towards their biological sex, what pointers do you have for them?
There's a lot of things that parents can do. Now, first of all, parents need to be informed so that they can understand what this entire issue is about. Otherwise, it's very confusing. You know, the terms, all these new terms that a lot of people have never heard before, cisgender, pangender, you know, there's a whole new language that is weaponized against the parents. So they have to understand that. They have to understand the history. But they also have to know they're not alone, and they don't have to go through this alone. A lot of parents, you know, I've talked to hundreds of parents, and one of the hardest things is feeling isolated. It seems like the entire culture is against you. You know, your neighbors, your in-laws, your brothers and sisters, the teachers and guidance counselor. It can feel like you're so isolated, but that's not necessary. There are thousands and thousands of parents that have kids that are going through this, and they are dealing with the same challenges. So I want parents to be aware that there are all kinds of groups and, you know, support groups. There are associations that exist in order to support the parents, and they can get to all of that on my website on the resources tab. Now, in terms of the child, you're going to be walking a tightrope. That tightrope is between being loving and supportive, but also holding on to reality. So, you know, you're not going to sacrifice the reality of your child being a boy or a girl, but you do want to remain. And in the beginning, you know, you want to be curious, and you want to give your child an opportunity to talk. What is this all about? You know, what is it like for them? Where did they learn about it? And I provide in my book, I don't know if you got to that point yet, because it's toward the end. I provide a model conversation that a parent can have with their child on this issue, and how the parent can remain loving and attentive, and yet, you know, stay in reality and not give in to the kids' demands, immediate demands for a new name, new pronouns, and puberty blockers and hormones. Now, it's not an easy thing to do, but it can be done. You also, very important, you want to get control of your child's internet use. And I have an appendix written by an IT expert on how to do that. You have to know where your kid is going online, what websites they're going to, and who they are talking to. The internet is filled with groomers who are more than eager to reach your innocent child. So you have to get control of your child's internet use. You have to put your school on notice. You have to let them know, and there's a form that you can print out from my website. All of that is available for free on the website. There's a form written by attorneys that put the school on notice. Your family does not permit your child to be exposed to gender ideology. You do not permit your child to be socially transitioned, what you mentioned before, Richard, which is the adoption of a new name and pronouns at school, permitting the child to use the opposite sex bathroom, changing rooms, and so on. Your family, the parents do not permit that, and you will hold the school responsible for any damage that comes about as a result.
Dr. Miriam Grossman, you have done a great service to us, to parents. I heartily recommend your book, Lost in Transnation, A Child Psychiatrist's Guide Out of the Madness. I think every parent should read this book, especially parents who have children in public schools. And again, you can find it at, is it Miriam Grossman, MD.com?
Yeah, Miriam, Miriam, like the sister of Moses.
Okay, very good. Very good. And beware, if you do go to Amazon to look for it, there are many look-alike books. It is not just make sure it is Dr. Miriam Grossman, MD's book, Lost in Transnation. Dr. Grossman, this has been just great to meet you and to talk with you, and appreciate all that you're doing. God bless you, and you keep up the good work.
Thank you so much, Richard. I'm going to say one last thing, and that is that the book is not written for professionals. It's written for regular moms and dads. It's very readable. And also, I don't want parents to wait until they're facing this catastrophe. This is a book for parents whose kids are any age, because you need to start early to inoculate your child against these dangerous ideas.
That's right. Very good. And I can affirm that. I'm going to use affirm in the best way I can. But I am reading it, and once you begin, you will be drawn in, and continue reading it through. It is very readable, very relatable, and very practical for parents who have children in the public schools and children who are just so much is bombarding them, so many different ideas and ideologies. And could not encourage parents enough to get a hold of this book, Lost in Transnation, A Child Psychiatrist's Guide Out of the Madness. Dr. Grossman, thank you again.
Thank you, Richard.
If you've enjoyed this program and would like to hear the full length, then please go to your favorite podcast platform and sign up for the Commonwealth Matters. While you're there, please rate us. This is really helpful. Also, tell your friends about us. We believe that the Commonwealth Matters is an important resource of good ideas, policies, and perspectives that will help shape Kentucky to become the best version of itself. Thank you.